Hey everyone, I'm your host Anthony. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. So hey everyone, and welcome to our live class. We're so excited to have you here today and looking forward to a great lecture. My name is Anthony and I will be your host. I'm joined on the line by Dr. Aristo Vojdani, the Chief Scientific Advisor at Cyrex Laboratories, who will be conducting most of the presentation today. I'm going to pass it off to him in just a moment to kick off today's presentation on the topic of why measure immunity by flow cytometry, which we're very excited for. But before we get started, I'd like to get all of your feedback. We have been doing these live classes weekly, and we want to be courteous of your time as we know everyone is busy with patients and running practices. So we'd like to get your opinion on what the best day and time would be for everyone to continue to hold these live classes. So I'm going to submit a poll right now, and please submit your answer to the poll. And don't worry, all of your answers come in anonymously, so nobody else can put see what you put. So please take a moment to submit your response to the poll so we can get a really good idea of the day that would work best for everybody. As we've been holding these on Wednesdays, and if that works, that would be fantastic. So let's let everybody take just a moment. Looks like we're getting most of responses. So thank you so much for participating in that poll for everybody that did. Now I'd like to go over just a few housekeeping items before we begin. I've muted everyone by default. And number two, if you have any questions during the course of this live class, feel free to submit them into the chat panel or the Q&A. The questions will come to me as the host, and I'll be conducting a live Q&A with Dr. Vojdani at the end of today's presentation. And lastly, we'll be hosting a live demo at the end of today's live class with our head of practitioner partnerships. So feel free to stick around if you'd like to learn more about how to save time and money with Rupa Health. With that being said, I'd like to hand it off to Dr. Vojdani to begin the presentation.
I would like to thank the Rupa Health Group and Dr. Krifasi for inviting me to speak about why measure immunity by flow cytometry. So let's, from the beginning, establish that flow cytometry is the most accurate method for counting the soldiers of the body, like the one you see on the screen: CD4 cells, CD8 cells, T helper 17, regulatory T cells, and more that I'm going to talk about. And secondly, our immune system, the immune system is our homeland security. So the immune system job is to protect us against variety of environmental factors, including cancer, infections, toxic chemicals, and more. And I did classify them under the second item, that extrinsic and intrinsic factors, or the exposome factor, who can influence the immune system years before disease development. And these are some of them: exposure to toxic chemicals, undigested food antigens, infections such as SARS-CoV-2, malnutrition, toxic emotions, stress, aging. All of that can affect the immune system, which could be detected by flow cytometry. The abnormalities of the immune system can lead to autoimmune disorders, allergies, and immune deficiencies. And thus, quantitative and qualitative changes in the composition of lymphocyte subsets, which I'm going to talk about, is giving us an opportunity for early detection and prevention of many immune disorders that affect 1 out of 3 Americans. So let's review the immune system. There are two major components in the immune system, as you know, innate and adaptive. As part of innate immunity, unconditionally, the first line of defense, or macrophages, dendritic cells, which is another name, can go after a foreign material such as SARS-CoV-2 immediately. And because the virus is a large molecule, large size molecules, the macrophages has to break it down to smaller pieces called antigens. The antigens will be presented by the antigen presenting cells to a component of adaptive immunity called T helper cells. T helper cells are going to produce cytokines such as IL-2, which activate another type of T cells to become cytotoxic lymphocytes. And these cytotoxic lymphocytes, within minutes or hours, will produce thousands and even millions of bullet-like materials called granules and release these bullets or missiles and destroy the virus such as SARS-CoV-2. Simultaneously, the same T helper cells will produce different type of cytokines, activating another type of cells to collaborate with B cells to become plasma cells, and the plasma cells are going to produce antibodies such as IgG, IgA, IgM, and in some cases IgE. And the beauty is these antibodies, some of them will be neutralizing antibodies, meaning their job is to go after the virus and neutralize the activity of the coronavirus or other viruses. During this process, two types of memory cells are going to stay in our body. One of them is called short-term memory B cells, and then another one will be long-term memory B cells. And the job of long-term memory B cell is to be alert in the future. If we'll get exposed to the same virus again, we'll start producing antibodies within 1 or 2 days. Because normally, when for the first time we get exposed to SARS-CoV-2 or other viruses, it takes 14 days to start producing antibodies. But for the second or third time, when we get exposed to the same virus, the job of memory B cell is to become activated and to start to produce antibodies within a day or two. So together, memory B cells, long-term memory B cells, and the cytotoxic lymphocytes protecting our body against viral infection. And that's why it's so important to keep our cytotoxic lymphocytes, our natural killer cells, and our B cells in the maximum activity. In relation to CD4 cells, as you can see in this slide, the naive CD4 cells, in the presence of different cocktails of cytokines, becomes Th1 with different cytokines or different cytokines produced by them, IL-2, interferon gamma, GM-CSF, although they have protective role in the immune system, but overactivation of that can participate in pathogenic inflammation and autoimmunity. T helper 2 cells, overactivation of T helper 2 cells will be involved in allergies and hypersensitivities. Regulatory T cell job is to keep the balance between Th1 and Th2. We have Th9, which also are involved in allergic responses. T helper 17, their job is to protect us against extracellular pathogens, but overactivation of T helper 17 also participates in inflammation and autoimmunity. The most pathogenic combination is a cell which carries receptors for Th1 and Th17 simultaneously and obviously participates in autoimmunity. We have T helper 22, T helper 2 and T helper 22, and finally follicular T helper cells, which produce IL-4, IL-21, and interferon gamma. Their job is to produce high affinity antibodies, and those antibodies can go after a virus such as SARS-CoV-2 and neutralize that virus. But unfortunately, these high affinity antibodies, if cross-react with human tissue, also participate in a variety of autoimmune disorders. So let's establish in here that there is individual variation in CD4 response to a variety of environmental factors, meaning you and I may be exposed to the SARS-CoV-2 or to formaldehyde. One of us may end up with overactivation of Th1, another person overactivation of Th2, and the third person with overactivation of T helper 17. And that's why it's so important to use flow cytometry and define our immune reaction to variety of environmental factors, including pathogens. And that method for measuring different type of lymphocytes is done by flow cytometry. So flow cytometry is study of cells as they move in fluid suspension, allowing multiple measurements to be made per cells. So in the laboratory, we take a drop of blood, we mix it with drop of reagents called monoclonal antibodies. And these antibodies have different colors. Those antibodies bind to different cluster differentiations and different type of lymphocytes, like Th1, Th2, Th17. And then these different type of lymphocytes goes into the narrow tubing, gets separated one by one, laser will hit them, and based on their colors will be separated. And in less than 1 minute, 20,000 cells will be counted and to be classified based on their subpopulation. And because each one of us, as I mentioned before, we have different patterns of lymphocytes, it is important to classify the lymphocyte subpopulation based on immunotyping. So what is immunotyping? Is quantification by flow cytometry of an individual's lymphocyte subsets to an identifiable pattern. As I mentioned earlier, you may have one pattern, I will have another pattern. And each one of these patterns deserve different attention and even different treatment modalities. So that is because the immune system in people is as diverse as height, beauty, intelligence, and other human features, because our genomes, our lifestyles, and exposomes affect our immunotype. And these immunotypes can be determined by flow cytometry with very high accuracy and reproducibility. up to 2010, actually from 1989 to 2010, I did many, many thousands of lymphocyte immunophenotypings of patients exposed to a variety of environmental factors. Then up to 2010, I used to do T cells, B cells, helper, suppressors, and NK, which is on the top. Now we call that partial immunophenotyping. But thanks to new technologies, new version of flow cytometers, new reagents, now we can measure cytotoxic NK cells, NKT cells, T helper 1, T helper 2, Tregs cells, T helper 17, and more. And I would like to emphasize in this particular case that T helper 1 and T helper 2 and T helper 17, we are directly staining them and measuring them. So after this type of technology became available, this measurements of cytokines, Th1 and Th2 cytokines, is not or could not be applied. Why? Because let's take interferon gamma. It's a cytokine produced by Th1. Yes, but it is produced also by follicular T helper cells. So when we measure Th1, when we try to measure interferon gamma, can we say 100% that interferon gamma is produced by Th1? No. IL-4 is produced by Th2. Yes, in majority of the cases, but also IL-4 is produced by another type of cells. So when we measure IL-4, is that reflecting Th2? Absolutely not. So now directly we are measuring Th1, Th2, Treg, T helper 17. Furthermore, the half-life of cytokines is between 4 to 16 hours. So if you measure interferon gamma today and tomorrow, you may get two different results. But if you do flow cytometry and measure number of Th1, number of Th2, T helper 17, Tregs, NKT cells, cytotoxic NKT cell, they will be reproducible from day to day for at least a couple months. So now let's look at some examples of test results. When we look at Lymphocyte Map, which is in this case comprehensive immunophenotyping of lymphocytes, Cyrex is reporting 29 different determinants. And it's ideal to have everything in range. But unfortunately, that happens in a very small percentage of the population. But to make it easy, I would like to emphasize that to pay attention to the Magnificent Seven. Okay, so what are the Magnificent Sevens? The Magnificent Sevens are white blood cell counts, okay, total lymphocytes, T and B cell ratio, CD4, CD8 ratio, T helper 1, T helper 2 ratio, Th17 Treg ratio, and total NK cell, cytotoxic NK cell, and NKT cell. So please remember, when you get the test results, first look at these 7 determinations. So why this is so important? For example, let's look at T cells and B cell ratio. That is reflecting the numbers of T cells and the number of B cells. And as you can see in here, there are receptors on each lymphocytes And some of those are specific to T cell, like CD3. And the others are specific to B cells. So the monoclonal antibodies staining the membrane of D cells, and flow cytometry is going to measure thousands of these in less than a minute. So the ratio reflects the total number of T cells and the total number of B cells. The same thing, CD4 and CD8, and the ratio reflects the number of CD4s and the number of CD8 cells, and they are stained based on specific receptor on the surface of each cell. I would like to emphasize one more time, Th1 and Th2, we are staining directly for Th1 and Th2, as you can see in this slide, and then we calculate their ratio. The same when we talk about T helper 17 and regulatory T cells, and finally natural killer cells, cytotoxic NK cell, and NKT cell. There are specific receptors on the surface of these cells where monoclonal antibody can stain them, and flow cytometer will measure them with high accuracy and reproducibility. So let's look at some abnormal test results, which is combination of immunotypes in patients with inflammatory disorder. If we look at the top, white blood cell counts is absolutely normal. Total lymphocyte, absolutely normal. Total T cell, absolutely normal. Total B cell is absolutely normal. So if this patient did, as part of their annual checkup, CBC and chemistry, the CBC would have been completely normal, and the doctor would have said, nothing is wrong with you. But what we see in here, the patient is suffering from hyperactivation of the immune system or hyperstimulation of the immune system. Why? Look at CD4, CD8 ratios. Okay, the ideal number for me is 2.5. Okay, but the rate, that's 1 to 4. 5.6, this kind of ratio I have seen in patients at the early stage of rheumatoid arthritis, lupus, and other autoinflammatory disorders. Look at T helper 1 cells, highly elevated, but T helper 2 also is elevated. And then regulatory T cells are within normal range, which trying to balance Th1 and Th2 and to prevent damage to the tissue in this individual. So this is a picture of an individual with hyperactivation of immune system. If will not intervene in this situation, the patient may develop full-blown autoimmune disease in the future. And again, I'm emphasizing that CBC and lymphocyte T and B cells are completely within the normal range. Another example of patient with abnormal T helper 17. This patient is in the beginning of lupus, systemic lupus erythematosus. What we see, white blood cell normal, T cell normal, total lymphocyte normal, B cells and T cells, CD4, CD8 ratio, everything is normal. But when it comes to T helper 2 is low, but T helper 17 and T helper 17 Treg ratio is extremely abnormal, and therefore this individual should be treated specifically for overactivation of T helper 17. And also the natural killer cells are highly activated. In my opinion, this individual either was exposed to SARS-CoV-2, or because the patient already is having lupus, maybe 5 years ago, 10 years ago, was exposed to virus such as Epstein-Barr virus, herpes type 6 or other viruses, and that's why the NK cells are in fighting mode, trying to get rid of the virus, but unfortunately the virus already did the job, and this patient is suffering from overactivation of T helper 17, which resulted in lupus erythematosus. To show also the beauty of lymphocyte subpopulation, even half lymphocyte subpopulation, the half of that way that I was talking about, that when was applied to patients with SARS-CoV-2 at the time of hospitalization, they looked at 340 different patients at the time of hospitalization. When they did partial lymphocyte immunophenotyping, they could classify them to two groups. One group with less damaged immune system. If you look, for example, at total T cells, 773, T helper cells, 457, even they are not ideal, okay? But they're much higher than 228 or 139, or the lymphocytes, 1,160 versus 425. So when they looked at the outcome of these patients who were hospitalized due to SARS-CoV-2, the one with the severe damage to the immune system, the one on the right, unfortunately, some of them did not survive the disease, but those with relatively normal lymphocyte subpopulation did survive and were discharged from the hospital. So ladies and gentlemen, let's put this question. Can we treat these two types of patients, one with relatively less damaged immune system and the one almost with no soldiers to fight, with the same medication, which is right now, it's done in many, many hospitals, which is dexamethasone? So the answer is no. Each one of them should be treated based on their immunotypes. That's my central message. So in summary of my presentation, I would like to present to you the clinical importance of comprehensive lymphocyte immunophenotyping. So the information obtained from lymphocyte immunophenotyping provide about our immune cells and how they work together has been proven time and time again. And I'm using only few examples from about 240 different research articles that I have in my binder. Example, patient with thyroid autoimmunity, which majority of them, not all of them, do suffer from Th1 activation, meaning higher Th1, lower Th2. When they were treated with anti-thyroid medication, the number of Th1 went down, the number of Th2 went up, meaning regulatory T cells can regulate the immune system and keeping the balance between Th1 and Th2 at the homeostasis level. Patients with rheumatoid arthritis, which majority of them do suffer from elevation in T helper 17, when they were treated with monoclonal antibodies against Th receptors on Th17 with Metotrexate and other anti-inflammatory agents, the level of Th17 went back to the normal. In multiple sclerosis, who do suffer from Th1 and Th17 simultaneously, remember, I call this the most pathogenic lymphocytes. By looking at their number and their percentages and their ratio, found that Th1, Th2, Th17, and Tregs cells are predictive biomarkers for disease activity in MS patients with a higher risk of relapse. Another meaning, if they have higher number of Th1, Th2, and Th17, the probability of relapse is much, much higher. So if you treat them for Th1 and Th2 and Th17, you can prevent relapse in these individuals. Patients with scleroderma also do suffer from elevation in Th17. When they were treated with medications, also the numbers go back to the normal. So the number of Th17 cells also was closely related to the disease activity. In patients with systemic lupus erythematosus, which I showed you example of that, which do suffer from high Th17, low Tregs cells, and these biomarkers, when they're in an imbalanced state, can help in determination of disease activity, treatment, and follow-up in the improvement of lupus and many other autoimmune disorders. In patients with psoriasis, treatment with anti-IL-17 resulted not only in an improvement in the immune markers, but also an amelioration of inflammation and skin lesions. So it's so important to do lymphocyte immunophenotyping and treat them based on that specific immunotype. Finally, as I emphasized before, in patients with SARS-CoV-2, those with a normal lymphocyte subset can survive the disease, but unfortunately, those with abnormal lymphocyte subsets and low number of soldiers, some of them will not be able to survive the disease. And finally, in the case of immunodeficiencies, in 2020, researchers, by looking at lymphocyte immunophenotyping, T cells, B cells, NK, helper, cytotoxic cells, could be used as a biomarker to establish immune deficiency in different patients. So based on that, we'll give them proper treatment, such as IV, IG, and other treatment modalities. So in conclusion, I would like to emphasize one more time the clinical importance of comprehensive lymphocyte immunophenotyping done by Cyrex Laboratories. Immunophenotyping measures the integrity of the immune system at the cellular level, enabling practitioners to classify their patient's immunotype or immunotypes. It can identify weakness or imbalance in the immune fitness of patients and will enable practitioners to design immunotype-specific immune rejuvenation plans to prevent or halt the progression of many immune disorders. Another meaning, based on immunotypes, we can detect and remove the triggers and try to prevent immune and autoimmune disorders. The classification of comprehensive immunophenotyping of lymphocyte subsets in the blood into 13 different immunotypes by Cyrex Laboratories would provide very useful surrogate markers for the diagnosis and treatment of autoimmune diseases, immune deficiencies, allergies, and hypersensitivities that affect 1 out of 3 Americans. And finally, the 13 immunotypes will enable practitioners to plan treatments targeted toward the patient's specific immune problems to relieve their patient suffering and improve their quality of life and monitor the recovery progress. Probably this is one of the most important slides that I'm going to conclude from, that personalized medicine should be based on personalized immunotype. So ladies and gentlemen, if a person is having high CD4 CD8 versus low CD4 CD8, can you treat them with the same medication? The answer is no. How about Th1 and Th2? No. Patient with Th1 should be treated differently than patient with Th2 dominant based on specific immunotypes. And the same thing applies to Th1, Th2, Treg, T helper 17, and other immunotypes. So we have to treat the patients based on specific immunotypes, which is measured by Cyrex Laboratories. So the last slide, the lymphocyte map is recommended when you want to know the state of your immune system or your patient's immune system. If a person always have a cold or frequent infections, or the individual's wounds are slow to heal, you have lots of gut issues because gut is important for immune function. You are tired all the time, suffering from chronic fatigue fibromyalgia. Your stress level is sky high because stress affects the immune function, and you have genetic predisposition for autoimmune diseases or cancer. So ladies and gentlemen, please consider lymphocyte map for yourself and for annual checkup of your patients, because CBC and chemistry is not enough. Thank you.
Thank you so much, Dr. Vojdani. That was amazing. This is a really fascinating topic and has really great utilization for patients, especially in our day and age. So you did a great job of diving really, really deep headfirst into that. So we received a lot of questions during the presentation today, and we're going to try to get to most of those now. So let's just jump right into the Q&A, Dr. Vojdani. So the first question we have for you is, what information do we get from lymphocyte immunophenotyping that we do not get from a CBC panel?
I think I did emphasize that even in two abnormal test results. But let me go back to those 20 something years I did flow cytometry, the partial immunophenotyping. In 80% almost of the cases with immune activation and autoimmunity and even immune deficiencies, we found the CBC, meaning the number of white blood cells and the number of lymphocytes were within the normal range. But when we did lymphocyte subpopulation, looking at T cells, B cells, CD4, CD8, and now looking at Th1 and Th2, Th17, Tregs cells, three types of natural killer cells, majority of those turn to be abnormal. So immunophenotyping is providing a lot of information that could not be detected by CBC, which is part of our yearly checkup.
Very interesting. Thank you for answering that question, Dr. Vojdani. We'll move on to question number 2, which is how much lymphocyte immunophenotyping can help early detection of immune disorders, including autoimmune conditions?
Thank you so much. There are many, many articles published in the scientific journals that antibodies could be detected, specific antibodies made against variety of tissues could be detected between 3 to 18 years before the full-blown development of autoimmune diseases. And I would like to go one step further. The lymphocyte or abnormal lymphocyte immunophenotyping even could be detected before abnormal levels of antibodies. So lymphocyte immunophenotyping is very, very important in early detection of autoimmune and other immune disorders, where intervention will make a huge difference in the life of patients and prevention of autoimmune and many other immune disorders.
Very good to know. Thank you so much for that, Dr. Vojdani. Moving on to question number 3. How much will lymphocyte immunophenotyping treat my patient and its follow-up in determining whether the treatment is working or not?
Yes. I think in the last few slides, I did establish that only few examples that I did establish that based on immunophenotyping, not only we detect abnormalities, we can follow the treatment and improvement in clinical conditions of patients, whether those patients did suffer from thyroid autoimmunity, lupus erythematosus, rheumatoid arthritis, or other autoimmune disorders.
Okay, that is very interesting. Thank you for that. We have time for a couple more questions here. So, do the same drug interferences that pertain to the Cyrex ELISA test, base testing, pertain to the lymphocyte map as well?
I don't think so, because the lymphocytes, first of all, let me go back. It depends on the length of the treatment. If, for example, you treat with Metotrexate for a few years, yes, that may affect the integrity of cluster differentiations on different lymphocytes. But if it's probably for a short period of time, 30 days, 60 days, 90 days, I don't think that is going to affect the lymphocyte immunophenotyping and their counting.
Very good to know for that, Dr. Vojdani. Thank you for that. So let's go over one last question here today, and that is, how long should a patient wait to retest to assess progression of immune rejuvenation protocol?
Thank you so much again for asking that. I did not show you my own test results. I did get COVID in July 2020. Hospitalized for 4 days, got treatment, and released from the hospital. Around July, from July, 6 months later, around December, when lymphocyte immunophenotyping of Cyrex became available just for research, I sent my own blood and my son's blood for immunophenotyping. And I knew my baseline based on years of doing immunophenotyping myself. And I found, even after 6 months, hyperactivation of my immune system. High Th1, high Th2, high T helper 17, and high natural killer cells. That's after 6 months. 4 months after that, meaning after 10 months, I repeated that, almost went back to normal. So I see that abnormalities of lymphocyte immunophenotyping could stay in our body for about 6 months. So my answer for treatment is, please do not rush and repeat the test before 6 months. Do your treatment for 6 months and then evaluate the outcome of your treatment modalities. So 6 months. Thank you.
Very good to know. Thank you so much for that, Dr. Vojdani. Those are some great questions that everyone asked today. So thank you so much for answering all those questions again. I know we weren't able to get to everyone's question today, but please reach out to us after this live class if you still need help. So thank you again for attending today's live class. I want to give a huge shout out to Dr. Vojdani and Cyrex Laboratories. This was a very interesting and helpful presentation to understand what flow cytometry is and how it relates to the immune system. So we hope to see you all at the next live class. And before you leave, I'm now going to pass it off to our head of practitioner partnerships, Adrian Martinez, who's going to put on a live demo of Rupa Health right now for all of you. So Adrian, thank you so much for joining us, and the floor is yours.
Amazing. Thank you so much, Dr. Anthony. Thank you to Dr. Vojdani as well once more. Really excited to be here this afternoon. For those of you who may know me already or be familiar with Rupa Health, if you have an account, you're welcome to hop off. But what I really wanted to do today is show you exactly what Rupa Health is. Who are we? Why are we putting on these live classes, right? So to tell that story, I would love to just start from the top, right? Who are we? Rupa Health is a lab testing platform. We are designed to essentially modernize the way that you would traditionally think about lab testing. And we do that in a few different ways. The first thing that we've done is we've brought on 20 plus different specialty labs, including Cyrex, onto our platform, allowing you as a practitioner to place an order from all of your different labs, manage and track the progress, status, view your results, all within one dashboard, as opposed to traditionally having to go to each individual portal to do so. The second and equally as important component to Rupa Health is the patient experience. What we've done is we've built an end-to-end patient experience, which is going to allow your patients essentially to be taken care of end-to-end. So as soon as you place that order on Rupa, we'll go ahead and take it from there. We offer multiple different payment options, including not only just cash and credit, but we can do HSA, we can do FSA, as well as setting up an interest-free 3-month payment plan with your patients. If they have any questions along the way, how to take their test, if they can't work with the phlebotomist options that were sent over, which we can customize for you, they'll reach out to our team and we'll manage all those questions for you. So the idea here is offloading a lot of the admin work that can sometimes be associated with lab testing off of your shoulders and bringing it onto ours. From there, you're alerted as the results come in, and you're able to, again, track and view all those results in one place. So I went ahead and shared my screen. Hopefully, you guys can all see that. If not, let me know. And it looks like we can see that. So what you're seeing here is the Rupa Health dashboard. I'm going to cover a few just important things to start off, but then from there, we'll walk through all of these great features over here on the left-hand side. But what I really want to show you just first and foremost is how simple it is to place an order on Rupa Health. So up here on the top right is a button where you can start an order. You'll actually see this button in a few different screens throughout the flow, but just in this main dashboard, this is where we'll go ahead and do that. To start an order on Rupa, you just need 3 bits of information. You need the patient's first name, last name, and email address. From there, we'll collect all the rest of the information directly from the patient. We do this for a few different reasons. We do this, 1, to ensure just more of a streamlined process for you as a practitioner, and 2, to ensure the accuracy of the information that we're collecting. Patients can move, right? Information can change. And so with that, we'll go ahead and collect all the information directly from the patient to complete the order. What you should see now is the ordering screen, right? And the first things that you'll see here in this ordering screen are actually going to be up at the top are your favorites. So custom bundles. We can actually create custom bundles within Rupa, a bundle being a set of tests, a set of blood panels, a combo of each, whatever you want it to be from any different lab that you want it to be from. So that way it's just one click and all of your tests are added into your cart over here on the right-hand side. Below that, we have the option of creating favorites. So your favorites being individual tests that you're most commonly using. So as opposed to having to go to each and searching through the catalog each time, you actually have access to your favorite test straight away. So it's as simple as clicking on whichever test that you want to add, and they're added into your cart straight away. Below that, of course, you have access to the entire catalog, which I'll show you here in a few minutes. With that, over on the right-hand side, you can see the tests that were added. Again, as simple as one click being added into there. If there's add-on tests available, you can click into this button here and add any test that's offered by the lab directly from here. How we manage shipping. Our tests are going to be defaulted to be drop shipped directly to the patients. We do work with a few different labs that offer in-office kits that will be shipped directly to you within your office, and then you'd be able to print out the requisition and see the patient in person. But in this day and age of COVID, we found that most of our practitioners actually prefer to have these tests drop shipped directly to the patients. Additionally, we'll go ahead and default the payment option to be invoicing the patient directly, right? As I mentioned earlier, we offer multiple different payment options: cash, credit, HSA, FSA, as well as a 3-month interest-free payment plan. Now, through this presentation, just to be cognizant of time, I'm going to keep things relatively high level, but I'll drop my information in the chat as well. So if you're interested in scheduling a personal demo with me where we can talk a little bit more details, how we'll work specifically with your business, I'm more than happy to do so. From there, you can add notes for the patient. You can add notes for Rupa. You can add ICD-10 codes as well. So if the patient wants to submit a super bill to their insurance for reimbursement after this, we can go ahead and add those ICD-10 codes. We have a full catalog of ICD-10 codes built in, so you don't have to know them off the top of your head. You can actually add little keywords in here, and it'll go ahead and bring up whichever words are associated to that specific keyword. From there, it's as simple as clicking send a patient. And that's it. That's how you can place an order on Rupa within a matter of seconds, actually, but making things much more streamlined to be able to place an order from all your favorite labs in one place. We do also offer the option to having you pay for the test yourself. So if you decide that you want to pay for the test and then, manage billing with the patient separately, that's of course an option as well. Real quick before we forget, let's chat about pricing. So you guys probably noticed over here on the right-hand side, a couple of different prices available. What we've done at Rupa is we've negotiated wholesale practitioner rates with all of our labs, meaning the same rates that you are receiving going directly to any of our partner labs, Cyrex, Genova, Doctors Data, will be the same prices reflected within our catalog as well. We do not upcharge them. In fact, we actually will charge the patient that practitioner rate. So a lot of times labs might have a practitioner rate as well as a patient rate. That patient rate tends to be tens and sometimes, if not hundreds of dollars more expensive, right? So through Rupa, your patients will always be paying that lower practitioner price. The way that we generate our revenue is on each order, there's a flat 7% processing and ordering fee. So that processing and ordering fee, in this case, $600 or closer to $500 with that Rupa savings is $33. That is paid for by whoever's paying for the tests, meaning that if you're having Rupa invoice the patient directly, the patient will be the one absorbing that $33 cost. Rupa is a free platform to sign up for and use, and this is the only cost that's associated to the account. So as a practitioner, if you're having us invoice the patient, you'll never see a bill from Rupa. Again, we're managing not only the process of you being able to order all your labs, but also offloading that entire admin experience that can be associated oftentimes with lab testing, up and even including specimen issues. We'll manage that directly with the patient as well as the lab, right? So from there, it's as simple as hopping back into our dashboard once that order has been set, and you're able to track all of your orders within this dashboard right here. You can search for specific patients. You can run filters by status of your order, right? So as you can see here, this is that order that we just created. It's in draft. As soon as you send that order through, it'll be sent to pending payment. And then you can track the progress of all of your orders by simply clicking into that order that's been sent. So for example, here's an order that's in progress right now. You can see here, it's 4 different tests, 4 different labs. And we'll provide updates as soon as we get them directly from those labs as well. So as you can see, the sample arrived on June 1st. Of course, this is my test account, right? So the date's still going to be a little bit off, but as you can see, we'll provide you with estimates as to when those results are in. As soon as those results are in, you receive that email. And again, you're able to view the results of all of your orders in one place. So hopping in here, I can download the results. I can send them directly to the patient. Just one thing to note, we won't send those results to the patient unless you give us the green light to. That's a setting that you can control yourself. But of course, you can send them directly to the patient through here. You can schedule a clinical consult directly with the lab through our systems. And then of course, you have access to that requisition. So just to highlight once again, all of your results in one place, as opposed to having to go to each individual portal to view them. And that's how you place an order as well as track it on Rupa Health. 2 very important things to highlight, right? What I want to just show you very quickly is just an overview of all of the labs that we're working with. So within the catalog, this is going to give you that overview of all of the labs that we work with, as well as all the tests that we have to offer. So you can run filters by specific lab. You can hop up here and search for your favorite specific labs. You can sort by favorite popularity. And then of course you can click into the details and get an example of all the details, including turnaround times, cost. You can download a copy of the patient instructions, a sample report, and any biomarkers associated with that. As I alluded to earlier in the presentation, you can start an order from here as well. So there's multiple screens where you're able to start an order, as well as directly through here up at the top right. Additionally, I can filter by sample type. This is also where you'll be able to hop in and create your favorites list by simply just adding a little heart next to your favorite test. Simple as that. So from here, I'm just going to hop down and show you some really cool features here. Additionally, I'm going to show you what the patient experience looks like. But before doing that, some really important things to highlight on this main screen. The messages portal, we of course have support. So you're always able to reach our support team directly through this portal here. You can adjust your settings to customize your portal, your account here. You can create those custom bundles. You can add clinic information. Additionally, we can set things up in a clinic format. So if you have multiple practitioners, or you have a PA or somebody who you're working with to create to place your orders for you, help manage your orders, you can actually add your team members in here. You'll each have your own unique login, so things are going to get confusing, and you're able to hop in here and work together and build out actually a clinic account. Additionally, phlebotomist. So if you have a preferred phlebotomist that you want to have your patient go see, if there's a blood draw required for your test, you can add that information in here, and we'll go ahead and send that out as we send out those FAQs and instructions to the patient along with their tests. All right. Lab turnaround times. One thing to highlight, Rupa doesn't stock the kits in-house. We are actually still working directly with the labs who are the ones sending those kits out. So with that, of course, there are varying turnaround times, and we like to highlight that. But should there be any reason for there to be a delay, as you can see at the top, Great Plains Mycotox is seeing a delay of 6 to 8 turnaround times, you'll be alerted up here. So again, we want to make things as transparent and easy as possible for you. So we'll always be alerting you should there be any term for delays. Within the support center, this is probably my favorite page. We have a ton of FAQs, instructions on here, our live classes, which you all just attended. You're able to hop in here, see what's upcoming, view any of the previous classes, which is great, as well as jumping into our magazine, which has tons of content where we're always updating and adding content into there. With that, I'm going to hop right into the patient experience, and then we can get on our way since we only have about 3 minutes left in here. And let me go ahead and move this Zoom tab here and hop into what the patient experience looks like. So to reiterate, a very important, if not, one of the most, the most important part of, getting tests done is the patient, right? We need to make sure that the patient is aligned and has all the questions answered. Let's be honest, a lot of these tests are not comfortable. Nobody likes pricking their fingers, let alone pooping into a cup. So there tends to be a lot of questions that come along with that. So as soon as you place that order through Rupa, we'll notify the patient that the tests have been ordered for them. The kits will be shipped out within 24 hours of payment. We'll send over those FAQs and instructions. We'll check in with the patient. And then, of course, you're notified as those results come in. So as soon as you place that order on Rupa, here's what your patient will experience. And this is the notification should the patient be the one being invoiced directly through Rupa. Hi, Joshua. Dr. Jordan has ordered these tests for you. We'll go ahead and introduce who we are, of course, and then highlight the different payment options that we accept: cash, credit, HSA, FSA, as well as a 3-month interest-free payment plan. From there, we'll collect all the necessary information to complete that order. Of course, basic information, shipping information, billing information, and then, of course, demographic information. And then if they go ahead and want that payment plan, we'll work directly with them to do so. We'll highlight the tests on the right side that were ordered for them. And they actually even have the option of delaying or canceling these orders, right? So if they click that button there, they have the option for 1 week delay, 2 week delay, and then even 1 month. Should they decide to cancel the order entirely, they have to write a reason code in, and then we'll go ahead and notify you as to exactly what that reason is, why they canceled that order. From there, they're notified once it's shipped out within 24 hours. And then down below here, as you can see here, here's an example of what the instructions will look like on the left-hand side. So we'll send over the instructions customized. You can see an example of the Dutch instructions on the right-hand side. Very comprehensive, extremely user-friendly as well. If there's a phlebotomy required, we can either customize those instructions based off of your recommendation, or we'll go ahead and send over the options based on the lab that we're working with. But through the entire experience, should the patient have any questions regarding instructions on their test, or even just, hey, I can't work with this phlebotomist, they can reach out to us and our team, and we'll work directly with them to answer any questions that they have. I know that we're at time right now, so I'll just go ahead and jump down. We'll walk them through the requisitions, and then, of course, you're notified via email. Couple just things to highlight here, right? Rupa Health is designed to make your life much simpler. And again, ordering all your labs in one place. It's free to sign up for. You go to rupahealth.com, click sign in, and we'll go ahead and walk you through that process. I'm going to drop my information in the chat real quick. So should you have any questions and want a direct meeting with me, go ahead and reach out to Adrian@rupahealth.com, and we can schedule some time to connect. I can go on a more personalized demo for you and show you exactly what we can do for your business. But with that, I know we're at time right now. I want to be respectful of everybody's time. So thank you so much for having me, and look forward to hearing from a few of you.